So we have baby boy Johnny, who is a 2-month-old male born via normal spontaneous vaginal delivery to a 31-year-old G1 now P1 mother at 36 weeks gestation, weighing 6 pounds 2 ounces at birth. He is presenting to us to the office today for his 2-month-old well child check. Mother began receiving regular prenatal care around week 7 gestation. She had a normal, healthy pregnancy complicated only by mild nausea and vomiting in the first trimester. No illness or infection. No medications taken other than prenatal vitamins. No history of substance abuse during pregnancy. Mother is an A positive, antibody negative, GBS negative, GDM negative, HIV negative, RPR and VDRL negative, GC chlamydia negative. No history of HSV, no history or risk for TB, immune to rubella, and Hep B negative. Maternal serum screening negative for trisomy 21, trisomy 18, and neural tube defects. Mother had a spontaneous rupture of membranes at 36 weeks, which was 13 hours prior to delivery. Bupivacaine epidural during labor with no prolonged stages. Baby boy Johnny presented cephalically with no use of forceps or vacuum. APGARs of 7 and 8. Johnny required bulb suction and supplemental oxygen at birth for slow, irregular breathing. Infant's breathing regulated after skin-to-skin with mother. Newborn screening completed at birth. Hearing screen passed. Hep B vaccination received. Vitamin K ointment given. Car seat test passed prior to discharge. Hematocrit was 18.2 at birth, and bilirubin was 17 milligrams per deciliter on day 2 of life, requiring phototherapy for 1 day prior to discharge. Infant was discharged from the hospital 3 days post-delivery. Johnny had some difficult latching initially, but now is breastfeeding well every 2 to 3 hours, about 10 to 15 minutes on each breast. Johnny is sleeping well and beginning to sleep about 5 hours overnight. He has awake alert time during the day. Johnny is reportedly a, quote, mellow and calm baby that does get appropriately fussy when hungry or wet. He is able to self-soothe with pacifier use. Developmentally, Johnny is smiling at his parents and beginning to make small vocalizations, such as cooing. He turns his head to noise and looks at the person holding him. He is observant, looks around, and seems interested in his environment, especially bright and contrasting colors. He is consistently able to hold his head up when held. Parents are giving Johnny tummy time and report that he is starting to push his upper body off the mat. Johnny has about 8 wet diapers per day, and mother is concerned about his stooling habits. He stools about once every 2 days, and his stool appears loose, seedy, and yellow. Mother reports that Johnny has gained weight since birth. Both mother and father have no significant past medical history. Mother's sister has sickle cell disease, maternal mother with a history of type 2 diabetes, maternal grandfather with history of prostate cancer, no significant past medical history on paternal side, family history negative for congenital and genetic disorders and respiratory disease. Johnny currently lives at home with his mother and 32-year-old father who have been married for 5 years with no previous marriages or children. No other family members living in the house. Family lives in a single-story, single-family home built in 2000 in the suburbs with central heat and air and city water. No pets in the home. Mother holds a bachelor's degree and was previously teaching high school, and father holds a master's degree and is a physicist at a chemical plant. Mother reports having a lot of questions about newborn care, but is, quote, getting the hang of it. She says she relies heavily on her siblings and asks them frequent questions. Father stayed at home for about 3 weeks helping mother after Johnny was born. Mother plans to stay at home to raise Johnny. Both parents feel as though they have good support systems within their family, as both families are local. No financial stress reported at this time. Reports that Johnny co-sleeps in their bed. Positive use of car seat that is properly restrained and verified by the local fire station. Father smokes cigarettes outside only. Parents report, quote, baby-proofing the house, including padded corners, smoke detectors, and having house checked for mold. Father does have guns, however, they are locked in a safe in the family's garage. Denied violence in the home, and mother reports feeling safe in her home. Discuss contraception with mother. No prior plan established with OB. Provided education and information. All concerns addressed with family. No additional concerns at this time. Good.